Good morning, everybody. Just so you know, we do have some donuts back here for y'all. Donuts, nuts filled with dough. Um, and there are also printed copies of the handout back there if you are a paper person. We'll start here in about a minute or two. Thank you. The Legos. What you making?
A Lego boat.
Wow, look at that.
But that is this.
Yeah.
So that comes with its own stand.
There's donuts in the back. Good morning. Donuts
Fried
in the
dough
back.
rings, eh?
Huh?
Fried dough rings.
Yeah.
Quick note. Well, Rachel. I'm sure that's creative because all my stuff is down there. She just seems to get it.
Before I forget, because I don't think
Yeah.
Rachel just needs to be added to the full-time staff distribution. Can you help me remember? I know she yours.
Go to IT support.
No shame.
I'm just saying. That's what
Anyone else needs? All right, everybody. Thank you for coming. I know it's a busy time and I know it's early. If you just came in and didn't hear, there are donuts right back there if you need one. I'm just going to say something real quick, as I always do, and I know you guys just kind of like wham, 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 wham. But I do want to just praise that God has provided again through our budget and through just how things have evolved, that we are able to maintain your portion of the first plan steady. So if you're on that first HSA plan, you won't have to pay any more on that. Unfortunately, the other two plans have had significant increases. All of them have, but we are able to maintain that level for the first plan, and then Chase will get into those details as we go along. I just want to thank Kristen and Anna and everybody for this process. There's a lot behind the scenes that y'all don't see. It's a lot of work, a lot of preparation. So just give them a round of applause. They do a great job. You all know Chase. We have to tolerate him here at New Vision, but we love him. No, seriously, he's a great guy, and he's doing a lot to really think through how we're going to be doing this in the future. Healthcare is just, I don't have to say it, you guys know. But we are looking at creative new ideas. I can't really tell you what that's going to look like in the future, but know that it's on back of mind that healthcare is an issue, and we are doing what we can for the future to make it plausible and stress-free for everybody. So just know that. Thankfully, these plans will be very similar to what we have now with a few minor changes, so you don't have to worry about, oh no, I have a new company, I need to find a new doctor. None of that. So that's a good thing. We're staying with UHC. So thank you for coming in again. The emails have gone out as far as Employee Navigator. It gives you the dates of when you have to make your elections, and the process is similar to every year, but again, if you have questions and kind of don't remember how to log in, we're here to help you. Brad Lamb is here, all-star from Pinnacle. He's going to be available as well. And these guys will also be available for a little bit afterwards to answer any questions you have. So thanks again. I'll pray to get us started, and Chase will kick us off. Father God, we thank you for your blessings, Lord. You know, sometimes we look at situations, circumstances, and think, how is this going to work? But you've already got answers, even in healthcare, Lord. And we thank you that you've provided resources for this ministry to take care of our staff. I pray that this will be an encouraging time, not a frustrating one, and that there'll be clarity, and that we'll be able to get off and running to our jobs later today. In Jesus' name, amen.
Check. Yes, it works. Good morning, everybody. It's weird being in front of people that I'm used to seeing in front of me. So yeah, we're kicking off the open enrollment. This is, I want to introduce my team real quick. This is kind of all the contact information that we have. These are in your handbooks and everything. But basically, I'm your agent. I represent all the different insurance companies in Middle Tennessee. I've been doing this this is my 27th year in the business, so I've been doing it a while, seen a lot of crazy stuff, and it's not a fun thing to be in health insurance, but it is what it is. We got to get it from somebody, so I'm your guy. I've also got Brad Lamb here with us. Brad is your day-to-day contact. A lot of y'all have already worked with Brad. Brad is excellent at what he does, handling all the day-to-day and innuendo stuff. We've had claims issues. People may have a baby, or anytime you've got any questions whatsoever, Brad is here to help you. So you can be reached by email, by phone. We've also got our Pinnacle representative. New Vision banks with Pinnacle, so William Moore, I don't even know where William is. Oh, there, over here, the one that actually dressed up for today. William's here just to be here and be supportive, and I appreciate you, buddy. But also, if you do have any bank questions, maybe William's here to answer that stuff. And then also, who's going to be handling a big part of this presentation is Nicole from United Healthcare. Last year, we had the United Healthcare rep come out with us, and I thought it went a long way, just helping to answer all those little detailed questions about these health plans. So we wanted to have our account manager from United to come up again this year to kind of go through all those details, especially for, there's just a lot of specifics on how each one of the plans works, especially the third plan that we offer, the Surest plan, that it covers things a lot of different ways. So we're going to go through that. But that's the gist. That's who all's in the room, and again, grateful for all them being here. Just to get started, basically, when people are eligible, if you're a full-time employee here working 30 hours or more a week, you're eligible for the benefit plans. That goes everything from health insurance to the dental, all the different benefits we offer. One of the advantages of being in a company like New Vision is you get to be part of these pre-taxed cafeteria plans, Section 125 plan. You hear them called different things, but that's just a plan that allows you to take the premiums that you pay for medical and dental and vision. They come out of your paycheck before you're taxed on that money. So it actually saves you money on what your premium would be. So if you're, paying $25 less out of your paycheck, that's $25 less that you're taxed. So the real amount of money you're spending on health insurance is actually a little less just due to tax savings. So it's a cool thing. The one thing the IRS does is, because you're committing to this plan when you sign up, by being a part of that Section 125, you're committing to the plan for a year until next open enrollment, unless you have one of these qualifying events. So qualifying event can be anything from marriage to, death or birth of a child, a spouse loses job, or even if you've got a spouse working and their insurance they're going through an open enrollment, and say their insurance coverage is better than New Vision's and you want to switch for some reason, that would be considered a qualifying event as well. We just ask that you notify Kristen or HR within 30 days of any of these events so that we can make sure that you're taken care of. And obviously, everything is done in Employee Navigator. Is everybody pretty familiar with Employee Navigator now? I mean, it's a really user-friendly system. It's got all your information there. When you go in there this year, it'll have everything that you currently signed up for. That's where you'll make changes. You can see what deductions are for things, how it affects your paycheck. All that stuff's in there. But we ask everyone to go in and log in to either enroll or waive. We want to make sure that everyone's had a chance to, be offered all the plans, to have a chance to enroll or unenroll, as well as enroll your families. We're going to start this. Did you say it was open this morning, Brad? Okay. So some of y'all have probably already enrolled. I mean, we always have people that are on top of it. So, but Employee Navigator is open, so it'll start today, and then when are we closing it? Monday the 17th. So it's quite a bit of time, actually. So you got 2 weeks, basically, to talk it over with your significant other, do what you got to do. But we just ask that enrollments be completed by the 14th. And then the benefits actually become effective September 1st. Any questions so far on Employee Navigator? Okay. Carlos talked a little bit about this, and I just wanted to say kind of, we've had a tough renewal this year. Last year, United Healthcare came in. Blue Cross was going up 40% last year. United Healthcare came in basically 40% under Blue Cross, and we moved over to UHC. This year, we've had a lot of claims. I mean, that's part of it. The reason health insurance is expensive is because healthcare is expensive. So we had another around 30% increase on all the plans. We shopped this out. Part of the due diligence is we represent all the different carriers like Aetna and Cigna. Oh. So I was trying to use that cool laser pointer. Aetna, Cigna, Blue Cross, Guidestone, who specializes in churches. We looked at some types of self-funded arrangements. But basically, UHC still made the most sense overall. I mean, some companies came in with a little better pricing, but it's just not worth moving unless it's really a significant change or if we're having really difficult issues with the current carrier. But UHC has done a great job. We've had a great year with them as far as we know. I'm hoping that everyone's had good luck with their plans. And, of course, if you got something that doesn't make sense or if you've had an issue that's been hanging out there for the last year, please talk to us. Brad especially will help walk you through to get whatever issue you've got resolved. What is New Vision doing to help with the cost of benefits? Well, the biggest thing to me that New Vision does that a lot of my clients do not do, we represent, 150, 200 corporations around Middle Tennessee. Most people are just passing the cost on to their employees. I mean, that's just the way it is. It's, a lot of companies, their number 2 line item is health insurance, so they just can't take on any more cost. Like Carlos said, we have had a great year here at the church. I'm part of the finance committee and see the numbers. I mean, God has been really, really, really good. And we've had a very generous year. And fortunately, New Vision is able to help with a lot of this increase. So we'll show you the deductions in a minute, but, and Carlos, correct me if I'm wrong, but basically on the first plan, the HSA plan is the one that most people are on. The church is basically covering that increase on that plan and then applying that same dollar amount to the other plans. But so you'll see a slight increase on the other couple of plans, but just know that the church is still picking up a lot of that increase as well. Like I said, we were looking at 30% when we started this process. We're also looking into things like captive insurance. I don't know if anybody really knows what that is, but that is just a very a creative type of self-funding tool that allows us to gain more control over our own cost within the church. As a small company, a lot of times you don't have these type options. But Carlos and Kristen are actually coming to an event we're having in Nashville to discuss captive insurance and how New Vision may be a fit. We had a rep out here. We're looking at that as an option. Wellness and telemedicine promotion. These are things that we try to encourage. Nicole's going to go through a lot of the United Healthcare things that they do in addition to just the insurance piece. That just helps everyone be more engaged. The more engaged everyone is, the better off, the better claims are going to be. Telemedicine, we have a great telemedicine deal where you don't have to pay anything to have access to a doctor for a lot of stuff. So we're going to go through that, but we want to promote that. And then again, just, the employer contributions were a huge deal. So, I mean, very, very generous of the church to contribute what they're doing this year, as well as just the contribution strategy in general. So, we just like to put up here kind of it's hard to really think because I know everybody sees what comes out of your paycheck and it's always expensive, right? But I think it's important to just know kind of what is that dollar amount that the church is, what is the church absorbing here to offer all this different stuff. So this just shows what the annual amounts are for all your different benefits. So if you're on a plan as an employee only, the church is basically paying you an additional $5,500 a year. If you've got a family, it's an additional $13,000 a year. You can see spouse and child, but most companies that we deal with pay 50% of the employee-only portion. Very few cover like spouses and children and family. So, I mean, the fact that if you've got a family on here and the church is picking up $13,000, that's a big number. That y'all are in the top 5% easily of all our clients. As far as just having a very rich benefit program and what the employer contributes. They provide long-term disability. The cost of that is $144. Telemedicine, again, just do not have to pay anything for telemedicine benefits is a big deal. That's $90 a year. Everyone's provided the group life insurance. And then you also have a retirement plan, where you're paying 50% of the employee contributions, up to 3% of annual salary. That's a big deal. I've got other churches insured, and I got to say, New Vision's program is one of the best that we've seen. These are going to be the new payroll deductions. I know, I guess we're just going to start with this because I know everyone's already wondering, what is this going to cost me? So I just wanted to go ahead and just flash this up here. These are what the new pre-tax deduction amounts are for the top 3 medical plans, then your dental, vision, accident plan. And then we're going to kind of go into the details of each plan here in just a second. I'll give everybody a chance to kind of soak that in. That's semi-monthly. All right, Nicole, you ready? All right, good deal. Do you want to hold this?
I don't know if I can hold all 3 things at the same
Here,
time.
I'll click it for you if you
Okay,
want.
great. All right, thank you. My name is Nicole Mothersbaugh. I am your field account manager with United Healthcare, and I have been for the past year, and looking forward to being with you all again. So we are going to go through some highlights of the plans. The first option is the high deductible plan, which I think a lot of you are on right now. It's got the $4,000 individual deductible, $8,000 for family. The out-of-pocket maximum is $6,650 for an individual and $13,300 for a family. Now, one thing I really want to note at the bottom is the preventive maintenance prescription drugs. Now, this is different because what they do is they waive the deductible for certain medications like high blood pressure medication, heart disease medication, high cholesterol, diabetes. So they'll waive the deductible and you just pay the copayment because we know those drugs can be expensive. Yep. Mm-hmm. Sure. Okay. If I can see that. Oh, okay. Sorry, I don't like to use notes, but there's certain things I don't want to forget. So, the second plan is the traditional copay plan. So this is the one where you have your copayments when you go, if you go for preventive well care, if you go just for an office visit or a specialist visit, you can kind of go down the list and see what your copayment would be. And then the prescription drugs are at the bottom. So tier 1 is $10, tier 2 is 40%, and tier 3 is 50%. Deductibles are at the top. Out of pocket is also at the top.
We're gonna go through kind of how to get the most out of the prescription plan later in the
Yeah.
presentation too. So
Yep, surest. So I'm just going to tell you, I've been on this plan for almost 2 years, and I love it. I was skeptical at first, but now I'm a fan. So some of what I tell you is going to be from a member standpoint, since I actually am one. So with the surest plan, you have co-payments for every procedure, every office visit. You know what it's going to be before you go. So there's no guessing. You always know. So these are just some of the samples. There's no deductible for individuals or for family. Now there is an out-of-pocket max, which is $9,000 for an individual and $18,000 for a family, but people rarely ever meet that. Okay, it's usually very low out of pocket, so we don't have very many people get to that point. Ooh, Teledoc, yep. So has anybody out here ever used the virtual visits, the Teledoc? Yeah, it's great. I used it myself probably about 2 months ago. I was on an airplane and came back, had a terrible sinus infection. I didn't even want to get out of the house. So what you do is you get on your phone and you go to the Teledoc app. You put in all of your information, your personal information, and then you tell them kind of what your symptoms are, and then a physician will come on the line. So the whole thing for me probably only took about 10 minutes. So I talked to the physician and told him, you know, what I was experiencing, and he gave me some prescriptions and called them into my Walgreens, the Walgreens that I use. So it was really easy because I just, you know, went down to my normal Walgreens. Took them about an hour maybe to get my prescriptions. Very easy. So I would definitely, if you haven't tried this, definitely do it. You can use it for a lot of common ailments like flu, like I said, sinus infection for me, sore throats, rashes. If you're bleeding, if you broke something, don't use it. But for just regular things, you can.
They just won't call in narcotics.
No, they will not.
But if you don't have this app on your phone right now, I encourage everyone to go ahead and register for this program, just because it's nice to already be registered when you need to use it. That process itself can take 20 minutes or whatever just to get registered and having everybody's social security number. So definitely download the app. You can just go to teledoc.com to do that. But I think this is one of the coolest innovations we've had in the healthcare world in the last 10 years.
I agree. One thing I did want to point out, though, is a zero copay. And if you get on the app and if it asks for credit card information, it may do that, but you're not going to be charged. So I've been asked about that a couple of times, so I just want to throw that out there. Okay, so this slide is kind of telling you, which most of you probably already know, how a typical health plan works. So at the start of the plan, you would pay 100% of all your services until you meet your deductible. And then once you meet that deductible, then your co-insurance will kick in at that point. And then if you do meet your out-of-pocket, you're finished. You won't pay anything else for the rest of the plan year. Okay, prioritizing care that helps you stay healthy. So this is preventive care. It's covered at 100%. So always check. We have a list out there that tells you by gender and by age what you need to have done. So you might want to check that, make sure that you're up to date. Okay.
Everybody's paying a lot of money for insurance.
Right.
May as
Yep.
well take advantage of that well care.
Yep.
100% on everything.
Yeah, even if you feel healthy, just do it anyway. So this is the Surest plan. Like I said, big fan, been on it for almost 2 years now. Highlights is that you see the actual prices. You don't see a percentage. I'm going to show you how to do that here in a minute. No deductible, no co-insurance. And the network is the same as the other plans, so it's a broad network. And then this quality medical coverage, I think what they're trying to tell you here is that you can go for little things, but this goes all the way to cancer treatment. And also, it's a shoppable experience. So, and I'm going to show you this too. So you can go on there and you can look for your providers, and you can look to see who has the best prices and where to go. So it's kind of up to you, to do a little bit of research there. And then if you do have any questions, there's always member services support. And if there's anybody in here that is not a member of Surest yet, you can also call this number. I will give you a code at the end here so if you have questions that maybe you don't want to ask right now. Okay.
I do, again, I'm a big proponent of the HSA plan personally. I know a lot of people are on the HSA plan. It's a great way to save for medical expenses. But one thing Surest does is the transparency on this plan is different than anything else in the medical world right now. The fact that you can scan a barcode and see exactly what you're going to pay at all these different doctor's offices is new to this industry. So that does make this an attractive option. I know you're going to go through that more, but.
Yeah, and this is, I think we've kind of already gone through this. This is kind of a preview. It's kind of, I think it's easier when you're trying to look at the options. You can do them side by side, so that it makes it, you can see it all at once. It's okay. Yeah. Okay, so like I said, you can look at the comparison grid and then decide what is best for you. So like I said, a lot of you are on the HSA eligible plan. So you have that HSA money that you can use throughout the year and keep. And again, with a high deductible plan, you have to meet your deductible, and then the plan kicks in. And with Surest, again, it's the actual prices, no co-insurance and no copay. Oh, I'm sorry, no co-insurance and no deductibles. Okay, so this is the part that I like. Does everybody have their phone with them today? I've seen some people with phones. So I'm going to show you how you can actually go through the plan. So if you can take a picture of that barcode. Actually, I'm going to get my phone and do it at the same time, if that's okay. Sorry about that. All right, so I'm going to take a pic of the barcode that's up here. Okay, has everybody done that? Everybody that wants to do that? Everybody has their phone? So this will take you to kind of a summary of the Surest plan for those of you who have it open. And if you hit continue all the way to I know you can't see it, but you'll get a screen where you can actually find, it's not on here, where you can find care. So you'll come to a screen where you can look at your provider, see if they're in the network. You can look at any procedure that you need done, and it's going to tell you exactly what you'll pay for that procedure. And you'll also notice some of the providers, the co-payments are a little bit lower, and that's just based on quality. The better quality, the lower the co-payment. Oh, there it is, yeah. Yeah, so that's what it looks like. You just type that in there. I like to give a personal experience. It may be TMI, but I give it anyway. So about a year ago, I had to get a CAT scan. So the doctor ordered the CAT scan. I'm in the lobby and I'm thinking, I don't know. I'm not a doctor, but let me check. So I went in just like this and typed in CT scan, and I saw the price. For me, it was $500. So I thought, well, maybe that's not entirely necessary. Maybe I can ask the doctor if there's another option. So I went to an ultrasound on this part right here, and I saw that it was a zero copay, and I'm like, well, I definitely have to ask. So I went back in, back to the doctor, and I was said, is there any way that we could get an ultrasound? Would this be the same, would you give you the same results? And she said yes. So we proceeded with that, and it worked great. I still have a kidney stone, but, that's okay too. Still just carrying that around, but we know it's there. Okay, next slide. Okay, so this is again just a comparison of the 3 plans. All have the broad network, same network, 100% preventative care coverage. Of course, option 1 has the HSA. You do not have to have a PCP, and you do not have to have a referral for a specialist. Okay. Okay. You see the FSA, is that? Okay, there's a check by option 1. Yeah, option 1.
To have an HSA, this is a good question. In order just to have an HSA, you have to be on what they call a high deductible health plan that's qualified with the IRS. So we have to design the plan. The plans that don't have copays are typically going to be the ones that are eligible for your HSA, to use an HSA account in conjunction with it.
But a few slides earlier, it looked like you could use FHSA with it.
So let's clarify. To contribute to an HSA, you have to be under the high deductible plan. If you had had one previously, you can use those funds at any time, even if you're no longer under the high deductible plan, but you can only make contributions under that first plan and participate in making contributions. That clear it up?
Kind of. I still like to see that other slide.
You're going to have access to all these. We'll email them out when we're done.
Because
I can talk through it with you
it's
separately.
purposely confusing anyway. So you never know for sure what they're talking about.
I understand. I'll talk to you after this and make sure you got all that info.
Yeah, and if anybody has any questions that they want to ask after the meeting, I'll stick around. I know sometimes you don't want to ask in front of the whole crowd. But now we'll move on to the pharmacy. So this is just kind of some highlights. Access to thousands of pharmacies. Obviously, you save when you use a network pharmacy, which I don't think you would have any issues with finding a network pharmacy here in Murfreesboro or really anywhere. And then it says better understand your coverage limits and take advantage of home delivery. Does anybody use the home delivery? Is that too personal? Okay. Well, it's a good it's a good option for your maintenance medications. You can get a 3-month supply. And bring them right to your house. Drop them off. It's very easy. Okay, so you also have the vital medication list, and this is covered at no cost to you. So this includes things like insulin, epinephrine, in case anybody has allergies, anybody has low blood sugar, covers the medication for that, opioid overdose, and the asthma inhalers. So those are all no cost.
Nicole, I have a quick question.
Yeah.
Does that apply to both the HSA and copay plans? Someone might have a question on that.
Yes.
Okay, it does.
Yeah.
Good.
Okay, so these are just some ways you'll see this on the PDL sometimes, and you may wonder what it is. So if you see your medication has a prior authorization, that just means you need to get your provider to send in a PA request. Sometimes there's also supply limits, so you'll see an SL on the PDL, and that just means there's a cap at how many you can get each month. And that's all regulated by the FDA. Okay, so this is a comparison, so you can kind of see what you would pay for each tier. For option 1, tier 1 is $10. Option 2 is also $10. $10 for sure. So you can kind of go down the line. Tier 1 is normally the generics, the more common drugs. Tier 2, you kind of get into generic and brand, so it kind of goes into a mix. And then tier 3 are usually the most expensive medications.
We'll talk a little bit too on the HSAs in particular, with most people being on the HSA, kind of how that drug program works. I know you've got the drug deductible for a lot of prescriptions, right?
You're talking about for the preventive?
Yes.
Preventive, yeah. Yeah, so with the preventive that we went over in an earlier slide, the deductible is waived. And, again, that's kind of, it's a lot of common medications, high blood pressure, cholesterol. What else is on that? Diabetes, just common medications. So you would just pay that co-payment. You would not have to meet the deductible for those medications. So that's a way that you can save money with your meds. There is, yes. And I also brought a list if there's something you want to look at after this. Okay.
Any other question on prescriptions? This is the most used part of the whole plan by everybody, so we've always got questions about prescriptions.
Did any of those change this year? I know last year the tiers changed a little bit on where they waived.
Yeah, because we were changing from another carrier last year to United Healthcare. So, I mean, granted, a drug sometimes can end up in a different tier. They can change that during the year, but no, for the most part, everything should pretty much be the same. Right, I mean, there's no
Right.
major changes to the tier programs. Good question.
Okay, so I'm sure you all have picked up your medication from the pharmacy. It's easy. Usually they have your information on file. You just pay what you owe, or you show them your new ID card. Just always make sure, they've got the most current information. I see that a lot. Okay, so this is just your pharmacy benefits on the go. So you have 3 options. I think that might be on the next slide. You can use myuhc.com. I don't know if anybody's ever used that. Does anybody have the MyUHC, the app, on their phone? Yeah, that makes things a lot easier. You can pull up your ID card. You can basically do everything that you can do on myuhc.com.
Skip forward real quick.
Oh, okay. Oh, yeah.
See that.
Right. So both myuhc.com and the app, you can look at your benefit information. You can look at your EOBs. You can look at, of course, the network. And like I said, if you need your ID card and you're out, you can pull it up right on your phone and learn about your preventive care, which, like I said, everybody needs to get that. And then cost estimates before you go, so you're not surprised.
Yeah, the app's great. Again, just like the Sheriff's Plan, I encourage everyone to download the app.
Definitely.
And then last, we'll talk a little bit about, these are just some extra things that United Healthcare does really well that are just part of your program, but, a lot of people don't use it because they don't know about it, so we just want to highlight, that these things are available.
So the first one is Calm Health, and that's for the traditional plan. So that's options 1 and 2, not Surest. So this is an app that you can get on that will help you sleep. It helps you with stress management. Has anybody ever used an app like this? Somebody told me recently that they used it, and there was a part in it with breathing techniques that help with your stress level. They said it changed their life, and I'm not sure about that, but I'd be willing to try it.
Is that the one that plays the white noise and stuff?
It does, yeah, it does that. Yeah, there's all kinds of different programs on it. Okay, the Employee Assistance Program, this is also for options 1 and 2, the traditional plans. And this is just where you can call in if you need to talk to somebody, if you're having any kind of issues at home, if you have stress, relationship issues, you can call them anytime and they can talk to you, talk about it. And this is also on the app and on the website.
I've had several people ask me about this one. So I know there's at least a couple of people in the room using the gym membership stuff, but I think that's a cool deal.
Yeah, the gym membership is really good. I looked last night to see how many gyms, and I just used Murfreesboro, and I found 22 gyms that participate in this program within a 10-mile radius. So if you did decide to do this, what happens is there's different tiers, and in each tier, it will list the gyms that you can use. And each tier does have a different price. And you can find that on the app and on the website.
And then this is something, I think a couple of people did this last year, but here's some free money.
Yeah, free money. Traditional plans, options 1 and 2. You can get rewarded for just doing things that you do every day. Just walking. It can track your sleep, and you actually get money for each thing that you do. And it will show you a whole list, and it will tell you what the dollar amount is. And that's just money for you, up to $300 for you and your spouse. It is on the app, yes.
More incentive to sign up on the app.
Yes.
Another incentive.
Yeah.
Download the app.
Yeah, the app is definitely the best place to go for all your information.
Again, all this is in your handbook too, so we want to just make sure it's available to everyone. That kind of wraps up our medical. Any questions on that? I want to go back real quick just to the. Well, maybe I shouldn't have tried this. Again, so to make it clear, I know we covered a lot of different stuff, and then, the plans, the fact you got traditional plans 1 and 2, then you've got this Surest plan that, has all these different copays for all these different services. But just remember, if you're on option 1, which again, the bulk of the church is on this option, they call it HDHP, that's the high deductible health plan. That's the acronym for the term that this plan meets all the eligible requirements for you to have a health savings account. So you can set up a health savings account to use with option 1. Then options 2 and 3 are your more traditional copay style plans. So you cannot use an HSA on option 2 and 3. But some people just really like having copays for all their different benefits, which is more important than maybe having cheaper premiums for the HSAs. So any questions on all that medicals? Okay, again, we're going to be around for a while after we're done, so feel free to ask any of us any questions on that. Go over real quick some of the banking benefits, especially the HSA, because we know a lot of y'all are using the HSA. I want to look at this screen, but I just can't see anything anymore. I have not broken down and gone and gotten glasses yet. So, Brad, make sure I do that, will you? Anyway, all right. So, for what a health savings account, this just means that you guys can contribute extra money into a savings account to use for that first option. A lot of y'all are currently doing it. Again, to be eligible for it, you got to be on the plan 1, the HDHP, the high deductible health plan. There's just certain things that you cannot have and also have an HSA. But basically anything can be considered a qualified medical expense. That can be everything from doctor visits, prescriptions, medical equipment. And there's also things like dentistry services or vision. You can buy glasses and things with your HSA money. It may not count towards your medical insurance premium or your medical premium, but or your medical deductible, but you can still use HSA funds for that. A lot of people do that. Pinnacle has a great program. Once you get, but William, I think it's above $2,000, right? Once you have a balance of $2,000 or more in your HSA, you can kind of treat it like you would a 401k. There's a lot of different mutual funds and stuff you can invest in. I've had a lot of people really save up significant amounts of money in their HSA. That you can use it for medical expenses, or you can just treat it like an additional retirement account. The great thing about HSAs is it's got what they call a triple tax advantage. So the money going in is pre-taxed, the money that grows is tax deferred, and then when you take it out, as long as it's used for a qualified medical expense, it comes out tax-free. There is nothing else like that we have available to us in the form of saving money. Retirement plans, you may get a tax deduction on the front end, but you're going to pay tax on it typically on the back end. Or a Roth IRA, you pay tax on the front end, but you don't have to pay tax on the back end. This is literally the best of all worlds. No tax on the contribution, no tax on the earning, and no tax when it comes out. So what can we contribute? The IRS has been really good about raising this amount every year. So this year, if you were a single, you could contribute up to $4,400. We know these don't match the deductibles exactly, but these are just the IRS guidelines. So if you're on the plan as an individual, you can contribute up to $4,400 last year. This next year, that's going up $100. We're starting to see that increase about $100 a year. Family coverage, you could do $87.50 this for 2026. In 2027, you're going to be able to do $89.50. And then if you're 55 and up, just an extra benefit, you can do an extra $1,000. It's kind of like on your 401k. They give you these catch-up contributions. So again, I love HSAs. I love the idea of, just how they work. They've been a big success. I'd say 65-70% of our clients offer an HSA in conjunction with a copay plan. The reason we give options is because we know not everybody wants the same thing. So, we're here to offer you whatever best suits the needs for you and your family. And then, but I guess we probably promote the HSA more than any other type plan. This is just a little bit about Pinnacle's HSA card. We have they call it a vertical card system, but what's kind of cool about our card is if you go and use this and let's say you're trying to buy gas with it or something, it actually will not let you do that. Used to, you could end up spending a lot of money out of your HSA on accident thinking it was some other card. So now you can, the card is a smart card. I've even had, let's say you've got a bunch of medical qualified stuff in your grocery basket and you go run all your groceries through, you could use your HSA and it would automatically take out all the different items that were qualified and charge that, and then relieve the remaining balance to be charged on another card. It's really cool. You can also do things like you can reimburse yourself back for expenses that you've incurred out of your HSA funds. So I've had people even go 10 years paying everything out of pocket, and then they're letting their HSA balance grow, and then at the end of that 10 years, they may pay themselves back at retirement tax-free for all the different expenses they had. Just a lot of different kind of creative things you can do with it. But this, the app we have is really engaging. So you can go online, do all the transfers, name your beneficiaries. Again, managing investments. We got 20 different mutual funds to choose from. Is anybody using the investment features on the HSA currently? I haven't really done it either. Seems like our family, I've been maxing out my HSA for 15 years and I still don't have $1,000 in it. Seems like we use it up every single year. But one of these days, I'm going to get to that $2,000 mark and start taking advantage of that. The mobile app's great. Again, it is specifically a health and wellness app, so it gives you, you can scan barcodes in the store to see if it's qualified as a qualified medical expense or whatnot. Then, a debit card basically for anybody in the family that's using it. So really, really good. Pinnacle's actually a preferred vendor for HSAs now throughout the state of Tennessee. We have a lot of HSAs out there. So again, if y'all have got questions about, getting an HSA card or whatnot, that's where you can contact our banking representatives or contact Brad in our office. We'll get you in touch with the right people. If anybody needs to get signed up for new bank accounts or whatnot, we can handle that as well. Any questions on the HSA stuff? I know I kind of went through that quick. I'll make sure we get y'all out of here. Okay, so the dental, I'll try to run through these fairly quick. A lot of people already kind of know how this works, but dental insurance, basically you've got Delta Dental is the best dental carrier in the state of Tennessee. You've got 2 free cleanings a year. The cleanings don't actually count towards this annual maximum. You'll see this, basically Delta will pay $1,000 worth of services any given year. But if you take cleanings, they also will pay for 2 cleanings a year. So $1,000 plus 2 cleanings is really what your benefit is for having Delta. If you get into the situation where the preventative service of the stuff covered at 100% that don't require a deductible, but basic services and major services, that's where you're going to start paying. Like for basic, you're going to pay 20%. Delta's going to pay 80% for things like simple extractions, fillings, the type of stuff you may have to deal with once or twice every couple of years. Then you get into major services like root canals, crowns, oral surgery, anesthesia, implants. That's the big stuff. That's going to be, you're going to pay 50%, and Delta's going to pay 50%. And again, they'll pay up to $1,000 for those type services any given year. Any questions on dental? On the vision, Blue Cross Vision uses the iMed network. iMed, there's a couple of different vision networks out there, but iMed covers a few of those big box retailers. Usually when you go into a vision provider, you just hand them their vision card and they're going to tell you exactly what your vision plan's going to cover. Because this is just a little bit confusing, but literally every time I've walked into a vision store, that you just give them the card and they'll tell you exactly what you can and can't have, what type lenses or what you have to pay for them. So it's usually about a $10 copay for exams. There's different copays for contact lens fittings, diabetic eye care, frames. You get up to $150 allowance towards frames. I know a lot of those designer frames are a lot more expensive than that, but this plan, it only costs very, very cheap plan. So you always get more out of the plan than what you're paying in. Different copays for the contact lenses or glasses lenses. Then also with contact lenses, you have a $150 allowance for contacts. From what I hear from most people, that usually covers the cost of contacts for the year. Basically on the frequency, you get 1 exam every 12 months. And, with the lenses or contacts, you get one or the other. So if it's lenses or contacts, it's once every 12 months. And then you can get new frames once every 12 months. So really good vision plan. I mean, a lot of your top corporations in the company, this is a very similar vision plan that they would offer. Anybody had any issues or any questions about the vision? These specs right here were $20, by the way. This is really quality stuff. All right, so now we're just going to cover real quick the life insurance and disability and whatnot. We have all that with Principal. Basically, if you're an employee of New Vision, you're getting $50,000 of term life insurance. So everybody gets that benefit. If you were to be killed in like a car wreck or some type of accident, that benefit would be double. So if we had somebody die in a car wreck, they would be $100,000 to your beneficiary. And while we're talking about beneficiaries, I think that's important. Make sure you review your beneficiaries in Employee Navigator and make sure they're up to date. I've had situations where people had an ex-girlfriend or something like that as a beneficiary, and they're going to pay whoever you have in Navigator as your beneficiary. Yes, sir. exactly right. Yeah, it's a contract between the insurance company and you, so they're gonna do whatever you have told them to do. It's a great point. Again, we've had some awkward situations come up where people just weren't checking. Now with Navigator, they're gonna kind of prompt you to check it, you know. Back in the old days with using paper and stuff was a disaster for a lot of people who'd never change that. One, just the benefit age reduction, that just means, you know, this term insurance is meant to cover people during their working years, which is typically up to age 65. So once you reach 65, if you're still on this, they just reduce the benefit by 35%. And then when you get to age 70, basically the benefit's reduced by 50%. That's the way all these group life insurance plans works. And again, this is 100% employer paid, so no cost to anyone. We also have voluntary life insurance. So you can buy in increments of $10,000 up to, if you're a new employee here, you can get up to $150,000 with no medical questions, or if you signed up for it when we initially offered it or whatnot. Brad, how does this work with buy-up? I want to make sure to mention that.
Chase is on the next slide, actually, where
Okay.
you have the 2 increment annual open enrollment ability to take additional coverage to increase it with no health questions by these amounts right here. So an employee increment, as Chase said, $10,000. You can get 2 increments, which is $20,000. The spouse, the increment is $5,000, so you can get up to $10,000. And of course, children's coverage doesn't need health questionnaires, so you can elect that at any time.
That's a really good benefit, and it gets overlooked all the time with group plans that we see. You know, just the ability to increase it a little bit each year is nice. People forget to do it, but we want to make sure and highlight that. So,
and Chase, I just wanted to mention, if you
Yeah.
don't currently have voluntary life, you're not participating, you can still elect those amounts. So if you don't have any as an employee, you can elect up to $20,000.
Yeah.
Same thing for your spouse, $10,000. So no health questions for that. But even if you do have to do a health questionnaire, they're actually built into Employee Navigator this year. So you don't have to fill out paper one or even go to a separate website. It's built right into your portal, and you can fill it out right then and there and be done with it. And
Yeah.
it's super easy. So don't let that stop you from looking. If you want additional coverage, it's easy to fill out the application for underwriting. If y'all have any questions around that, let me know. We've had several other clients that have utilized this year, so it's great.
Yeah, great benefit, and then, again, just being able to do it through payroll deduction is nice. Again, you can do 50% or 100% up to whatever you get on yourself or your spouse. However, the maximum on your spouse is $30,000, and then you can insure all your children for $10,000 for a very minimal amount. If the unthinkable were to happen, you know, it's nice to know there's financial protection there at least. Accidental coverage, this is, you know, I'm not going to go through all these different benefits, but I think the accident plan is a really cool plan just because especially if you have kids that play sports and y'all had some kind of accident that happened throughout the year, you probably need to talk to us about getting a claim covered if you're on this accident plan. Or if you had a wellness visit last year and didn't go out to principal and like fill out the form for the wellness benefit, talk to us because we probably owed some money on this thing. But this just covers all different types of accidents. And I mean, it can be anything from my daughter sprained her ankle a couple of times in cheerleading. You know, I didn't even think about it till like a year later that, oh, that probably was covered under and sure enough, it was covered under the accident plan because she had to have, you know, the x-rays and had to go to the emergency room. So there's little benefits that pay for that type stuff. The more serious the accident, the more it can pay. We've seen accident plans pay tens of thousands of dollars for some people for certain type stuff. So, you know, the accident plan, again, is cheap. It's great for kids just because kids are always getting hurt. I mean, it's just part of it. But I know we've got pretty good participation on this. And again, if you're on that plan and if you didn't think about it when you had a child get in an accident, make sure and talk to us, because again, we can still file that claim and get you paid on that. So be sure and try to think about that. I always try to at least highlight that while we're going through it. Same thing with critical illness. This is kind of like living life insurance. Although if you, this is what's going to pay you. If you have something like a major critical illness, like a heart attack or cancer or whatnot, this is the benefit you can buy on yourself that'll just pay you a one-time lump sum amount for, if you had a $50,000 critical illness plan and you have a heart attack, this plan's just going to pay you $50,000 tax-free to use for whatever, medical expenses or whatever you want to use it for. But the critical illness plan is an awesome benefit just for those. Those are usually the times where you need extra money more than any, is when you're up in a, hospital for some type of critical illness. So that's just a great benefit. This does have the true open enrollment, right? So you can, if you need, unlike the life insurance, this one, if you didn't sign up for it last year, they allow you to sign up for it each year without asking medical questions. So that's a really big deal. So if you don't have it currently, I would encourage you to check out the critical illness. Again, you can enroll for it this year with no medical questions asked. That's a big deal. You couldn't go out and buy it off the street without having to answer medical questions and whatnot.
And Chase, I want to mention the wellness benefit. If you're enrolled in critical illness, that also applies to the critical illness plan. So you could get both benefits if you're enrolled in accident and you're enrolled in critical illness. You go get your wellness visit from your doctor. All you have to do is contact us, contact principal with those medical records. They have a process, but just let us know. Yeah, you can get up to $100 a year.
Yeah, I guarantee you there's somebody in this room, if not multiple, that have that plan, went to the doctor for a physical last year and just didn't even think about that. So be sure and let us know. We'll get you paid on that. Let's talk a little bit about disability. Again, this is, in my opinion, the second most important insurance out there behind health insurance. This is just what covers your paycheck if you can't work. So we have voluntary short-term disability. So you can purchase disability that'll pay basically 60% of your pre-disability earnings up to $1,000 a week if you have to go out on any type of short-term disability. So this starts paying basically after the 14th day of any type of illness or injury, and then on the 14th day for sickness. So it's the same thing. So after 2 weeks, you would start receiving that benefit. And that benefit is paid out tax-free. Since you're making the contributions pre-tax, the benefits are paid tax-free. If you did not sign up for it last year, there would be medical questions, kind of like the life insurance on this one. But if you're a new employee starting, you can sign up for this. There's no medical questions asked. The only deal is they have this pre-existing condition limitation, meaning if you were treated for something in the past 3 months, they don't cover that for the first 12 months. That's pretty common language on any disability plan. But an awesome way to protect your paycheck if you can't work. The benefits would last basically 11 weeks. So after the 14 days, you would be paid that benefit for 11 weeks. And then to dovetail that, we have the long-term disability. Again, this is provided, so everybody has this. This one, in my opinion, is the most important type of disability insurance. My dad was my first claim in my career with disability. He was a dentist. His fingertips all of a sudden got numb, and he couldn't practice dentistry. And he was only 53 years old, and this is what kept his dignity the rest of his life. He had disability coverage, and because he couldn't practice dentistry, he was fine otherwise, but the disability is what paid his paycheck for the rest of his life. So long-term disability is just really important. The way this would work is if you go out on long-term disability, after that 90-day period, again, we got the short-term disability you can buy to cover that first 90 days, but this kicks in after 90 days and will cover you out to Social Security retirement age, whatever that is. It's different depending on how old you are. But that'll pay up to $5,000 per month. There are some limitations like mental health, drug and alcohol abuse. Those are limited for a 24-month benefit period. It's pretty standard on any disability contract. And again, it's 100% employer paid. So awesome benefit. I'm glad everyone's covered by that. I've seen this destroy more people than anything other than not having health insurance. And I believe that's it. So, any questions on all of that we just talked about? Again, we're going to be around for a few minutes or for a little while, however long we need to be. So, ask me, Brad, Nicole, Carlos, Kristen. They're pretty educated on
We
this now.
actually, Chase, we actually do have one, our group banking slide.
Oh,
which
sorry,
is next.
sorry,
Yep.
sorry. You're right.
Yeah.
Yeah, so another benefit we do have, if you're an employee here at New Vision, you do have the ability to sign up for our banking services with Pinnacle. So basically, it's just, you can get a checking account, no fees. I think if you open, William, do you know much about how the new checking accounts work? Like, is there a promotion going for that now?
Yeah, there is. There's one promotion that actually gives you $100 cash back after you meet a couple of different criteria. And then there's another that closes pretty soon, but it gets you to 2 free Titans tickets, which we're all hoping that you're going to have to come back here, right? But yeah, any question you have about that, please don't hesitate to get in touch with me. Brad and Chase both have my information. We'd love a chance to talk to you more about it. But outside of the checking accounts, the free accounts, there's other benefits. There's discounts on fees associated with home equity loans, home loans, and things like that too. So, and that's all benefits that go to you guys and gals for just being employees of New Vision.
Yeah. Thank you, William. Yeah, great banking benefits that you wouldn't get just otherwise. So we encourage everyone, if you're looking for a new bank, Pinnacle's a pretty good bank. William had just mentioned this, there's also all these other benefits you can get just from working with us, insurance reviews. By the way, if anybody has personal insurance reviews they want to have looked at, we have a whole personal insurance department. We're happy to review any of y'all's homeowners, car insurance, all that type stuff. We have guys that specialize in that. Happy to do that free charge, and just make sure you're paying what you need to be paying on that stuff. Wealth management services, all that's just part of the group banking service that we offer.
You also, anyone that needs to review, if you're looking at doing individual life, that's your man right there.
Yeah. Anybody anybody's looking for life insurance above and beyond the plan
Exactly.
can talk to me about that as well. I know I've helped a few people out in here for that. But yeah, with that, I think we're done. So thank you all. I know that's a lot of information.
Thanks, everybody. And again, just keep an eye out for that employer navigator email. And it's the 17th was the deadline. So we will email this slide out to y'all here this afternoon. There was, notice one typo already with the tiers, but we'll clarify that. Thanks again for your time. I know it's tough on a Tuesday morning and it's busy. So please take advantage of these folks staying around for your questions and have a great day.